So I would check my order set first and see that we have an indwelling catheter order. So I'm gonna grab all my equipment, check it, make sure it's not expired, and make sure I have everything I need before going in the room.
Come in.
Hello.
Hello.
My name is Devin. I'm gonna be your nurse today. Can I start by having your name and date of birth?
Yeah, it's Ivy Armstrong, 3/9/1964.
Awesome. And do you have any allergies?
Yeah, I'm allergic to latex.
All right. It looks like it matches your armband. How are you doing today?
I'm doing all right. Yeah, pain's pretty low.
That's good. So I have an order to place a urinary catheter today. Is that all right with you?
Yeah, but what is that?
So what we're going to be doing is we put this is a sterile procedure. So we're going to, I'm going to set up my workspace in between your legs, and then we're going to kind of go in, we are going to go in through your urethra, and this is going to go all the way up to your bladder. And from there, this is where the urine is going to come down in the tube and empty into a bag. Okay. And this is so you don't have to get up or get on a commode or anything, since this is probably the safest way to go for you right now.
Okay. Is that going to hurt?
No, it should not hurt. Okay. So you might have a little discomfort, but it's not going to hurt. So.
Okay.
All right. Is it all right if I use your bedside table?
Yeah, that's fine.
All right. And I'm going to get... I don't see any khaki wipes.
Oh.
That's all right.
Could just pretend?
Yeah. Nick's getting me a khaki wipe. My room is out of khaki wipes. Thank you. I appreciate it. Okay, since this is a sterile procedure, I'm gonna wipe off your side table. Make sure everything is clean. So you haven't had one of these
No, I haven't.
Urinary catheters before?
No, this is brand new to me.
All right. Well, that's all right. I'm going to talk you through it as we go. And I would make sure that we have some privacy.
Thank you.
And all of our lights are on, so I can see everything. Your bed is locked, and we raised you up to the proper height. So I'm going to pull back your sheet. And I'm just gonna ask that you spread your legs open a little bit so I can set up everything here.
Okay.
And I'm gonna make sure the genitalia is in the correct spot. Okay.
Sorry about that.
That's all right. We can just put it back where it needs to go in.
Weird things happen as you age.
Right, nothing stays where it's supposed to be, right?
That's my motto.
So I'm setting up right now our sterile field.
Okay.
And one of 2 sterile fields. Okay. That's the shiny side. I'm gonna expose you, okay?
Yeah, that's all right.
We have our curtain shut, so no one's gonna come in. Our border. And I realized I reached over my sterile field there and I shouldn't do that, so. All right, next I'm going to put on my sterile gloves. Do that.
I think this is COR. Cath is like,
Those hallways are loud.
Okay. Oh, really? Okay, so then I would lose it. Okay. All right. And I'm gonna add some lube to this tray.
Okay.
And I have to get it from over here, so I'm gonna break sterile field to do that. Okay, now back in sterile field. And I touched the bag there, so I shouldn't be doing that. That would break sterile field and I would need to get new sterile gloves. I'm gonna get lube on the end there, and I'm gonna get my syringe with sterile water. now I'm ready to set up and clean the area where the catheter is going to go into. So I'm gonna use my non-dominant hand to spread open the labia. I'm gonna do the furthest side away from me, the side closest to me, and then this down the middle. And while holding the labia open, I'm gonna feed the catheter in. About 2 to 3 inches without my non-dominant hand touching the labia until I get urine return. After that, I'm gonna feed it another 2 to 3 inches to make sure that I'm in the bladder all the way. After that, I'm gonna let go and trade spots with my hands. And then I'm gonna inflate the balloon with 5 milliliters of water. I'm gonna pop the syringe up. And give it a slight pull to make sure that we're snug.
That wasn't so bad.
Good to hear. All right, so I'm gonna cover you back up for right now.
Okay, thank you.
And I'm gonna clean up this stuff in the area and put your bag down next to you. Below the bladder. And since my gloves are soiled, I'm going to also change those out real quick. And you don't feel any pressure or pain?
No.
Okay, that's
really
good.
not
That's
bad.
what we like to hear. And I should have told the patient to bear down whenever I was inserting the catheter, which I did not do. And I should have done that. And that's so the catheter can get into the urethra a little bit better, a little bit easier. So next I'm going to get I'm going to secure the catheter with the strap. To keep it in place. Okay, and I'm gonna make sure you cover back up. You can kind of close your legs a little bit for me.
Thank you.
Okay. Okay, there we go. Everything feel all right?
Yeah, doesn't feel too
Awesome.
bad.
Okay, so I'm going to get a sample of urine from the catheter. If
Okay.
that's all right with you.
Yeah.
Before I put these on, I'm going to sanitize again. And with my pen that I'm going to write on over here, I'm going to put my name, the time, and the date that I put this catheter on, or catheter in, so we know, okay?
Cool.
And then, so I'm going to get a urinary sample from you. And all we got to do for that, okay. I'm gonna sanitize this with alcohol for 30 seconds. 28 to 9:30. I'm gonna have my empty syringe to get a sample. My empty clean syringe. Okay. And then and that's all you got to do. We have your urine sample. So I'm going to label, date this, put my name on it, put your name on it, and the time that we collected it, and send this down to the lab for your analysis.
Okay, that wasn't too hard for me.
Great. And so I'm going to clean up my area real quick. This all goes in the trash. And you want me covered back up?
Yes, please.
All right. Okay. And I'm going to lower your bed back down. How are you feeling?
I'm feeling pretty good. Yeah.
Okay. So your call light's in your left hand. And do you need? Is there anything else I can do for you? Is there anything else you need?
No, I think I'm pretty good.
Okay, great. So I'm gonna go put this in the computer and document everything that I did, and send off your sample to the lab.
Awesome. Thank you so much.